her campaign is financed by every casino owner in town, every corporate entity based in Las Vegas. Me, on the other hand, I've got a handful of donations from friends and family. So what does that tell you? That tells you that when it comes time for an important vote in Washington, D.C., I'm going to support the people. The people are who I work for, not the casinos, not the ultra-rich people. So we see that happening constantly with the Republicans, but it also happens with some Democrats too. So you have to take into consideration who's financing these campaigns, and that's where there's a great deal of difference between us. Now there's plenty of other differences too. Our stance on health care is also a big difference. As with most of the moderate Democrats, Susie doesn't really take a position other than she says she's going to work to improve health care and to fix the ACA. Me, on the other hand, I am all in with Medicare for All, single payer, and I actually know how the system works because I'm an insurance agent and I've sold health insurance for 18 years. So I know that the ACA at this point cannot be fixed. The Republicans have successfully sabotaged it. That's not Susie Lee's fault, but it is her fault for not realizing that it's too late to fix it and that we have to move on to what would have been better for everyone in the first place. The rest of the industrialized world has figured out that health insurance, health care should be nationalized, should not be for profit, and we need to follow suit. It's the only true way to resolve the incredible costs that rise every year by double figures. We just simply cannot keep paying all of this high percentage of our GDP for health insurance. It makes us uncompetitive, and it makes the people broke. People can't afford it because they can't afford anything nice in life. They can't contribute to the economy because they're just trying to survive. And that's from experience with me. Our monthly health insurance bill is through the roof, and we don't get anything out of it either because we have such a huge deductible. So, I'm not alone in that. And people out there that have group health insurance that get it through their employer, they don't feel it as much because the employer pays at least 50% of the premium. That's what they have to do to be eligible for a group plan. So they don't feel it as much as somebody like me who's self-employed. But the fact of the matter is, when those companies are paying so much money and so much more every year for health insurance, they don't have enough money for raises, for better benefit packages, for other investments that could make that employment better for the individuals. So that's a big difference too. Sure, Medicare for All would be business friendly because, as I was saying earlier, even when you get your insurance through a group health plan, your company is spending significant amount of money to be able to provide that for you. Upwards of 18 to 20% of our GDP is spent on healthcare. So if these companies did not have to worry about that, if they did not have to employ huge staffs of human resources just to implement this health plan, if they could actually pay less to cover you in additional taxes rather than actually paying for these health insurance benefits, that's going to benefit the company as well. That's not just in Nevada, that's nationwide. But of course in Nevada, everybody considers Nevada a business-friendly state because we have no state income tax, and the corporate taxes are rather low as well. That's not a specific to Nevada situation, but Medicare for All obviously would help Nevada companies the same way it would help companies all across the nation. I've said before, back before the ACA came into play, health insurance companies, they did assume a lot of risk because the people in their pool, they didn't know what was going to happen, what kind of medical expenses they were going to incur, and in some cases that's millions and millions of dollars. So they deserve to make a profit because they're assuming that risk. But now with the ACA, everybody's eligible, even folks with pre-existing conditions. These health insurance carriers get guarantees from the government, so basically they cannot lose money. So if they're not assuming any risk, really what are they providing the people? In my opinion, they're providing nothing. All they do is create additional administrative costs, create roadblocks for people. Everybody has been frustrated one time or another with being in network, being out of network, co-insurance, co-pays, prescription co-pays. It's just crazy, the hoops that people have to go through even when they do have insurance. So it's just common sense. If they're not assuming risk, if they're really not providing any benefit, all they're doing is taking billions and billions of dollars off the top, let's just get rid of them. Move to a Medicare for All platform, similar to what we have right now with Medicare for seniors. The administrative costs on Medicare average around 2% as compared to around 15 to 17% on standard health insurance plans. When you're talking about something that's approximately 20% of the GDP, that's billions and billions, possibly trillions of dollars. So let's get smart like the rest of the world. Let's take care of all of our people regardless of pre-existing conditions or ability to pay. The majority of the American public is ready for it. We just need some brave politicians to actually get behind it and push for it. Even Republicans. This should not be a Democrat or a Republican issue. There are plenty of Republicans that actually agree. Warren Buffett being at the top of my list of examples. I mean, that man knows a little bit about business, and he's a huge proponent of single payer. Anybody who spends any time researching it is going to come to the same conclusion. It's just common sense.